Now that we've covered stimulants, let's go on to Chapter 18, Depressants. Both REM and non rapid eye movement sleep occur cyclically during sleep at about 90-minute intervals. The period of REM sleep episodes becomes longer during the sleep process. If sleep is interrupted, the cycle begins again with stage 1 non rapid eye movement sleep. It's difficult to rouse a person during rapid eye movement sleep. Individuals also perform better during their waking hours if they experience all types and stages of sleep. Most of recallable dreams are experienced during the REM sleep, and if a person is roused from REM sleep frequently, a vivid, bizarre dream may be recalled. Let's begin with the non pharmacologic methods to improve sleep. First would be arising at a specific hour in the morning, avoiding late daytime naps, avoid caffeine, alcohol, and nicotine 6 hours before bedtime, avoid any heavy meals, strenuous exercise, and drinking large amounts of fluids before bedtime. Some things to do would include taking a warm bath, listening to quiet music, or performing other soothing activities like drinking warm milk. You should also work to decrease your exposure to loud noises or that blue light from screens. Should our non pharmacologic interventions be effective, we may move on to medications. Everything from barbiturates, benzodiazepines, melatonin agonists, and sedative hypnotics for older adults. Our general side effects would include residual drowsiness, vivid dreams, nightmares, drug dependence, drug tolerance, excessive depression, respiratory depression, and hypersensitivity. In the case of barbiturates, these could be long, intermediate, or short acting. You want to restrict to short term use because of side effects, including drug tolerance, and try to limit use to 2 weeks or less to avoid dependence. They interact with a lot of things, everything from alcohol, opioids, and other sedative hypnotics. They also decrease the effect of oral anticoagulants, tricyclic antidepressants, and may cause hepatotoxicity, toxic to the liver. Next up would be benzodiazepines, alprazolam, lorazepam. These are no doubt drugs you've heard about a lot. In the case of sleep disorders and anxiety, lorazepam and diazepam are the most common. They interact with the neurotransmitter GABA to reduce neuron excitability. They can be used for everything from reducing anxiety to treating insomnia. We want to recognize cues, determine whether the patient has a history of insomnia or anxiety disorders. We also want to work to decrease functional ability, reduce stamina, and the patient will receive adequate sleep when taking the benzodiazepines. Just like when we give pain meds and we want to carefully assess, did it work to relieve their pain? We're giving a benzodiazepine for sleep. We want to carefully assess, is it effective? If this drug is not effective, we should look at other options. With benzodiazepines, monitor the vital signs carefully, especially respirations and blood pressure. Use a bed alarm for older adults and for patients receiving hypnotics for the first time, as confusion can occur, injury could result, sleepwalking can be common. You also want to observe the patient for any adverse reactions, especially the elderly or debilitated. When discussing sedative hypnotics, these non benzodiazepines, zolpidem's one you've no doubt heard of, especially by its trade name Ambien. This is for short term use only, less than 10 days. It works to as a neurotransmitter inhibition and has a duration of action of 6 to 8 hours. It also comes with a very real adverse effect and danger of sleepwalking. There's people that have woken up in the middle of the night and cooked a full meal, not remembered any of it. There's people that have driven to the store and driven home, don't remember any of it. There was also who was that Roseanne blamed some of her tweets that got her fired from her show on taking Zolpidem, Ambien, saying she was sleepwalking and didn't remember it. Melatonin agonists, like Ramelteon. This is the first hypnotic not classified as a controlled substance. It works to selectively target the melatonin receptors and to regulate circadian rhythms. It has adverse effects like drowsiness, dizziness, fatigue, headache, nausea, and suicidal ideations. We want to use all of these medications very cautiously with the elderly. Begin with the non pharmacologic methods first, then go to short to intermediate acting benzodiazepines. These are considered safer for the older adult. You want to avoid benzodiazepines such as flurazepam or clonazepam and even diazepam. and encourage use 4 times a week or less, as they seem to be much more sensitive to it. When assessing these patients, especially on sedative hypnotics, non benzodiazepines, we want to recognize cues, ascertain the patient's problems with sleep disturbances, obtain a drug history, monitor for any decreased level of consciousness, any reduced stamina. And we're going to have a goal that the patient will remain asleep for 6 to 8 hours. We're going to do everything from monitor vital signs to check for signs of respiratory depression, any slow, irregular breathing patterns. Use a bed alarm because, again, these patients can become confused, could even sleepwalk. And we want to prioritize safety at all times. Moving on to anesthetics. This is going to be, generally speaking, they depress the CNS, alleviate pain, and cause a loss of consciousness. In the case of a balanced anesthesia, this is a hypnotic given the night before, sort of a pre medication with an opioid analgesic, or benzodiazepine. The hypnotic is usually given the night before surgery to ensure adequate rest. The preoperative medication is then given approximately 1 hour before the surgery. That preoperative medication can include opioid analgesics and anticholinergics to decrease secretions. There's going to be 4 stages to general anesthesia: analgesia, excitement or delirium, the surgery itself, and the medullary paralysis. Before surgery, we want to assess things like their age, current health problems, pregnancy, a history of heavy smoking, and a frequent use of alcohol and drugs. Because all of these are going to play a factor in which choice of anesthetics used and how effective these anesthetics are going to be. In the case of inhaled anesthetics, these provide a smooth induction and are usually combined with a non barbiturate such as propofol, which is the drug that killed Michael Jackson. Also, it could be used with a strong analgesic such as morphine. The adverse effects of an inhaled anesthetic are respiratory depression, hypotension, dysrhythmias, as well as hepatic dysfunction or malignant hyperthermia. Consciousness usually reoccurs minutes to an hour after discontinuation. Another option may be intravenous anesthetics. These have a rapid onset and a short duration of action. Everything from droperidol to ketamine, midazolam, and even propofol. Induction and maintenance of these anesthesia or conscious sedation for minor surgeries or procedures. The patients are sedated and relaxed, but can be responsive to commands. Another option may be topical anesthetics, such as mucous membranes, broken or unbroken skin surfaces, and burns. They form like solutions, liquid sprays, ointments, creams, gels, and they cause a decrease in sensitivity to the nerve endings. Another you may have heard of is local anesthetics. These block pain at the site where the drug is given. Used in everything from dental procedures, suturing skin lacerations, short term minor surgery at a localized area, or blocking nerve impulses, such as a nerve block below the insertion of a spinal anesthetic. Local anesthetics have 2 different groups: esters and amides. Amides have a very low incidence of allergic reaction, such as procaine or lidocaine. They have a rapid onset and a longer duration of action, cause fewer hypersensitivities reactions than procaine as well. Spinal anesthesia. This is a local anesthetic injected into the subarachnoid space. In adults, it's below the first lumbar space, though in children, it's below the third lumbar space. Side effects could include everything from respiratory distress, headache, and hypotension. Spinal column nerve blocks could begin with a spinal block, epidural block, caudal blocks, or saddle blocks, placed at the lower end of the spinal column. When dealing with any anesthetic, we want to obtain a thorough drug and health history, noting drugs that affect the cardiopulmonary system. Analyze cues, everything from pain, airway obstruction, and watch these patients very closely. Often after surgeries, they're going to go to a specialized unit called the PACU, the Post Anesthesia Care Unit, while they recover from the anesthesia. We want to observe that preoperative and postoperative urine output, monitor vital signs following general and local anesthesia, and administer an analgesic with caution until the patient fully recovers. For our first practice question, which nursing intervention would be most appropriate for a patient taking temazepam? That'd be A, monitor for fever, B, give the drug intravenously only. C, monitor daily weights. Or D, tell the patient to ask for help before standing up. And that answer is going to be D, tell the patient to ask for help before standing up. Question 2, what would indicate to the nurse that a patient taking a sedative hypnotic requires more teaching? That be A, the patient wants to listen to music on the radio. B, the patient has saved her urine to be measured. C, the patient says she has only taken 1,800 milliliters of fluid a day. Or D, the patient requests a cup of kava kava to help her sleep faster. The patient requests a cup of kava kava to help her get to sleep faster. Remember, we never want to combine, just like with our stimulants, we never want to combine caffeine with other stimulants. We never want to combine over the counter depressants with our analgesics as well. Question 3, an older adult complains of insomnia. Which suggestion would be most appropriate to the nurse to provide as an initial method to deal with this issue? That'd be A, take Benadryl pills each evening before bedtime. B, drink warm milk or chamomile tea before bedtime. C, develop an exercise regimen for the evening hours. Or D, take naps during the day whenever you feel like it. And that answer is going to be B, drink warm milk or chamomile tea before bedtime. Question 4, a patient is taking a hypnotic nightly to enhance sleep. Which of the following is most associated with adverse effects of vivid dreams and nightmares? That be A, hangover, B, tolerance, C, hypersensitivity, or D, REM rebound. That answer is going to be D, REM rebound. Question 5, which of the following is the most serious adverse effect of spinal anesthesia? That be A, hypotension, B, headache, C, respiratory distress, or D, tachycardia. That answer is going to be C, respiratory distress. We always prioritize airway, breathing, circulation. And for our final question, which drug is commonly used for conscious sedation? That be A, midazolam, B, halothane, C, isoflurane, or D, lidocaine. And that answer is our benzodiazepine, midazolam. But anyway, that's all we got for this chapter. I'll see you in the next slides.